Hello, my name is Stephanie and I'm a midwife at Monash Health. In this video, I'm going to talk to you about a few things you are likely to experience over the first week or so after having a baby. I'll talk about bleeding, pain, going to the toilet, your moods, and what is not normal that you need to get help for. Then I'll cover a few topics about caring for your baby, including getting to know him or her and how he or she acts when tired, what to expect with nappies, caring for your baby's eyes, and the neonatal screening tests. After having a baby, you will continue some blood loss for a few days, or possibly a week. This will gradually become paler. You may be sore down there in the perineal area, whether or not you have had stitches. Daily showering is the best way to keep the area clean and help healing and recovery. You may have some raw areas where you have had grazes or need stitches, which sting a little when you go to the toilet to pass urine. We recommend you drink plenty of water so that the urine isn't too concentrated, as this can help reduce any stinging. You should expect to open your bowels around 3 days after you give birth. You might find it helps after having a baby to hold a pad on the perineal area for comfort when gently bearing down on the toilet. It is quite normal to feel some after pains in the tummy as your uterus contracts back down after the birth. Usually some mild painkillers such as paracetamol and a hot pack can help ease this pain. Around the 3rd day, you might feel a little low in mood. This is called the baby blues, and you have probably heard of them. A lot of women will even feel teary and wonder why. It's all quite normal as your hormones are just readjusting. There are a few signs and symptoms which, if you experience, you should take seriously and let your midwife or doctor know. Seek emergency help if at home. If you experience sudden and heavy blood loss or increased persistent blood loss, if you feel significantly lightheaded, dizzy or raised pulse or palpitations, fever, shivering, abdominal pain or really smelly vaginal loss, this may be a sign of a bit of retained placenta or membranes or infection. Headaches accompanied by visual disturbances or vomiting, calf pain, redness or swelling, shortness of breath or chest pain. Your baby needs to get to know you in the first few days. He or she has been used to a quiet, warm, wet, dim, small area where food and oxygen came through a tube, the umbilical cord. Your baby is now dressed and it is noisy, drafty, cooler, dry, bright, and has to suck to get food. Your baby communicates by crying and gestures, so you will need to learn what the different cries mean. Is your baby tired, hungry, wet or dirty? Or he or she may just want to cuddle and to feel your heartbeat. After all, those were the sounds and the feelings for months in the womb. You won't spoil your baby at this early stage. Talking to your baby and smiling can help to calm your baby as well as help them to develop. You will see how they react to different noises and movements. You may have seen some babies jumping or startling when they experience new things. These are all normal ways a baby responds. It's great to learn when your baby is tired. Watch for droopy eyelids and slow blinking, stiff and jerky movements, eye rubbing, irritability and crying. Your baby's nappy will need changing quite often, usually at feed times initially. As baby gets older, you will need to check at other times. The first bowel motions are dark green, almost black like tar, and sticky. They will change to lighter green and go yellowing and look like there are seeds in it once the milk is passing through. At first, you may not realise the baby has passed urine as well, because these bowel motions are quite runny. It's normal for your baby to lose weight during the first 5 days of life. If the weight loss is more than 10% from birth weight, your midwife will help you with a feeding plan and assist you to make sure your baby is getting enough food. Sometimes this may mean you need to express your milk and feed more regularly. Most babies regain their birth weight within 1 to 2 weeks. Most babies become a little bit jaundiced as their bodies need to break down lots of red blood cells which are no longer needed now that they are breathing air. This process releases a chemical called bilirubin, which makes the skin yellow. Newborn babies can also develop all sorts of rashes, which usually aren't serious and don't need any special creams or treatments. Most newborns are perfectly normal. However, there are a few disorders and illnesses that might not be obvious at birth. Newborn screening tests are recommended for all newborns to help identify some of these congenital problems. The goal is to reduce the effects of any conditions through early treatment. Screening tests involve collecting a few drops of blood from your baby's heel. The blood is sent to a special laboratory for testing. If all these tests are normal, you won't hear more about the tests. If anything shows up that is not an average result, you will be contacted to go and get more definite tests done. It's common for babies to develop sticky eyes or discharging during the first week. The most common cause is blocked tear ducts, and this usually gets better by itself. Gentle eye cleansing with water or a little bit of breast milk in the eye is generally very effective for sticky eyes. It's good to check with the midwife or maternal and child health nurse or GP if you are unsure. On behalf of Monash Women's, I wish you all the very best. You might find some of our other videos helpful too. Just check the website.